Good evening, and thank you for joining us, and welcome to our first Lane County Town Hall on the vaccine distribution effort, where we're at in that process. My name is Jason Davis. I am the Public Information Officer, which is essentially a spokesperson for the COVID-19 effort from the county. I would like to start off this evening with some thanks. Thank you, first of all, to each of our panelists. Taking the time out of their evenings away from their families to address our community and provide this very important information. Also, thanks to all the folks who are doing the work behind the scenes that our organizations are represented here tonight. I know certainly Lane County and Lane County Public Health. We've had a lot of people working on this effort, both in terms of the COVID-19 response and also the vaccination effort. So thank you for those who are in the trenches, so to speak. Also, thank you to Metro TV for allowing us to utilize your services to broadcast this on our social media accounts and website, and also cable channel 21. The purpose for tonight is to create clarity, encourage transparency, and empower our community essentially through information. We want to essentially share with you everything that we know, and we're going to attempt to do that this evening. We're going to try to answer as many questions as we can that have been sent in. I will say there have been hundreds of questions that have been sent in, and we appreciate how concerned our community is and the level of detail that they are requesting in some of those questions. Those questions that we're not able to get to tonight, we will be updating our FAQs on our website, so please check back there. And also, please do sign up for our vaccine update that we send out weekly. You can do that on our COVID-19 page at lanecounty.org. There's a graphic there at the top that you can sign up, and then we will send you updates about our vaccine progress, including the answers to some of those questions. We are going to first start off with an introduction of the folks that we have joining us. First off, I'd like to introduce Dr. Patrick Ludtke. He is our Senior Public Health Officer at Lane County Public Health. We also have Dr. Jim McGovern, who's the Interim Chief Medical Officer for Peace Health, and also the Incident Commander for their COVID-19 effort. We are also joined by Dr. Jessica Versage, who is the Chief Medical Officer for Mackenzie-Willamette. And also Chief Joanna Campy, who is the chief over there at Eugene Springfield EMS. Krista Dillon from the University of Oregon is their Director of Operations for Safety and Risk Services. And finally, Dr. Stacy Chance, the Chief Medical Officer for Oregon Medical Group. Thank you all for joining us again. We're going to begin our dialogue this evening with an update from Dr. Patrick Ludtke, our Senior Public Health Officer, who will go through both an update and also some background information, specifically looking at the vaccine development process, the FDA approval process, the complicated ethics that go into how to distribute a vaccine that is so limited in supply. And finally, the rationale of the Oregon Health Authority's phased approach. And that will help set up our conversation this evening. So without further ado, Dr. Ludtke, will you please walk us through those things?
Happy to do so, Jason. Thank you. And echo Jason's thanks for the panel members and for each of you who've joined us today through whatever method you are joining us. Thank you for being with us today. So I will walk through, as Jason mentioned, those three areas: the FDA approval process, some ethics discussion, and then a bit further about the state rationale around our vaccine priority groups. And really the easiest one is the FDA vaccine approval process, even though it's quite complicated. That process is a multi-step process. I suspect many of you have heard about phase 1 trials, phase 2 trials, phase 3 trials. Those are three of the phases that the Food and Drug Administration, or FDA, requires manufacturers to go through and prove that their products, whether it is a new drug or a vaccine or some type of medical implement that might be used, let's say, in surgery, or perhaps put inside your bones to make your fracture fixed, each of those have to go through those processes to prove that they are both safe and effective. Now, for these vaccines, those trials started some time ago. The first vaccine trial started in February in the United States. which is really remarkable. And I think at the outset, it's really important to note what an incredible achievement that is. I've been in the medical space for 30 some years, and I can tell you that we waited literally a few decades for some vaccines that we are using today. The whooping cough vaccine is one of them. We had vaccines early on that caused some pretty bad side effects, and we waited 20 some years to get an effective whooping cough vaccine. Here, for these first couple COVID vaccines, the same calendar year that the virus showed up in North America, we have 2 vaccines approved and effective. That's just remarkable. So keep that in mind. Yes, we don't have enough of those vaccines, but it's remarkable we have any vaccines at all in such a short period of time. So early on, the first thing that a vaccine producing company will do is they will work on phase 1 trials. And those phase 1 trials are generally very small, sometimes even just 100 people. And they are made to prove that the product is safe, and then to start to look at the immune response. Does the chosen chemicals that are in that vaccine produce an immune response in humans? And that's a small phase 1 trial. If that trial is positive, meaning that it showed safety and it showed some kind of immune response, then the company will move on to phase 2 trials, typically a bit larger, sometimes 1,000, sometimes 2,000 persons involved, and that will look at dosing. So they've already proved that this particular vaccine can produce an immune response, but do you need 5 parts of that vaccine, 10 parts, 50 parts? How do you get the right amount to make sure you get a good balance between immune response and side effects? And anybody who's ever had a sliver knows that when you put something sharp in your skin, you get side effects, right? I mean, it hurts and you can get an infection on occasion, it gets red, etc. And a vaccine in some ways is really not much different. Although vaccines typically have many fewer chemicals than a dirty sliver you pick up around your home or in your backyard. So if they move from phase 1 to phase 2, they do a larger trial with more people. They look at dosing and they look at expanded safety data. And if they pass phase 2, then they can move on to phase 3, which is a much larger trial. By way of example, the Pfizer vaccine, which was approved in December for use, had 44,000 people in the phase 3 trial, which is really a large phase 3 trial. And in that trial, they look at how effective is the vaccine. That's the critical piece. And then they also expand the side effect assessments. And as you might imagine, if a side effect is, let's say, occurring in 1 in a million, well, you're not going to see that very often, most likely in a small phase 1 trial or a phase 2 trial. And you may see one in phase 3 or you may not. So that expanded safety data occurs in the phase 3 trials as well. So the first 2 vaccines that have been approved and that we are now using in the United States, the Pfizer vaccine and the Moderna vaccine, both had huge phase 3 trials in the 35 to 45,000 person size. They had vaccine efficacy that was shown. Roughly 95% of infections were prevented with these vaccines. And they showed a good safety profile, which was the reason, those 2 combined reasons that they resulted in the approval by the FDA for use. Now, that's not the end of it. People think that, wow, the product made it to market, the company's making money, we're done. We're not done. Partly because if there is a 1 in a million risk, we might not see it until 1 million people get vaccinated. So what happens is this post-marketing assessment of ongoing data. Some of you who are listening or watching today may have already received a vaccine dose or 2. We're hoping you're participating in that post-vaccination data gathering to the benefit of all the rest of the persons who are not vaccinated yet. One of the ways that happens is through this product called Be Safe. It's an application you can put on your phone, and you will be able to share in real time some of your side effects. But that's the FDA process, the Food and Drug Administration process. We're happy again to say we have 2 vaccines that have made it through. We have 2 more that probably in the next 3 to 6 weeks will get their phase 3 trial data released. Probably will be positive, good data, and they may very well hit the market here by March, maybe in volume. So that's a wonderful thing. And we're very happy that we are in this space in this time. We just wish we had more vaccines in the pipeline. So next is the ethics. So now we have these vaccines. They've made it through phase 1, 2, and 3. They've hit the market, but we don't have enough of them. So we have, in some sense, an ethical responsibility to make sure that we use it as efficiently and effectively as possible. And typically what we lean on, just like we lean on the ethical criteria for treating any other particularly ethically challenging situation, we lean on these criteria that we borrow from our legal colleagues. There's some big words in these spaces, but essentially we try to do the most harm and the most benefit and minimize harms. That's one of them. We try to promote justice. We want to make sure that this is fair across all population groups. We want to take a strong look at health inequities. Not everybody has access to healthcare. Not everyone has insurance, etc. Some people might have insurance, but it's hard for them to get to a clinic or a hospital. And then finally, we want to promote transparency and make sure that everyone understands these processes. There are fancy words that we use in the legal space for each of those: beneficence, non-maleficence, autonomy, and justice. Those are some of the ethical principles. But that's what we are basing the allocation of this very limited resource to, both at the federal level and then here in Oregon. And that leads me to the last piece for my part of this, which is the rationale behind the phased approach. Again, there are a few key elements. There's far more demand than supply, so this is something we just don't have enough of. We have a pandemic going on. This is not just a seasonal influenza outbreak. This is a pandemic where there are large parts of society that are really affected in a negative way. And how do we make sure that we can continue with critical pieces of society going forward? So when you apply those ethical principles locally, you start to ask questions like, what groups of people are essential to the COVID response? And that makes us start to think, well, we need to vaccinate the vaccinators first so that they can go on and vaccinate the other priority groups. We think of other questions such as, well, what groups are at highest risk? Early on, of course, we didn't know when this virus first broke out in Wuhan, China. But now we know clearly the elderly have a much higher risk. But we also know people with immunocompromise, people who have some lung and heart disease are at higher risk as well. So we have to ask ourselves those questions. We also have to look at the people who maintain critical functions of society. It wouldn't be that beneficial to us if we were able to vaccinate all the nurses and doctors, but there was no food on the shelves in grocery stores. There were no police and fire around. And, we just endured a nasty fire season. Gosh, it sure is nice that we have those functions that are functioning. So we start to ask ourselves those critical questions. And that's what the Vaccine Advisory Group for the Oregon Health Authority, our state health department, has done to determine the rationale behind these prioritized groups. It's a bit complicated, I think. We talk about the phases and then the groups. We are currently in Lane County vaccinating persons in phase 1A, and they have 4 subgroups. And those subgroups include a lot of different people in the health space. But that is where we are now. And I will finish before I pitch it back to Jason by just saying that we have been lucky in our county for a long time to have this massive medical infrastructure. We not only have 5 hospitals and lots of clinics and urgent cares, but we have a lot of people working in that space, and we are a major referral county for surrounding counties, even getting patients from Northern California. But what that means is we have a lot of people who are in phase 1A who need to be vaccinated before we're going to get to the rest of you. So just keep that in mind as we go forward and as we get to the Q&A session. And Jason, back to you, sir.
Thank you, Dr. Ludke. That's certainly elaborative, and there's even a few pieces in there that are good reminders for me. We're now going to move into a section of the town hall where we're going to hear from each of the organizations represented tonight, an overview of their efforts in the vaccine distribution process. Part of that's going to include planning efforts and other parts of the process that might not be directly giving people shots in the arm. I'm going to begin with doing that for Lane County, and then we're going to move on from there. Next up will be Dr. McGovern from Public Health, or from Peace Health, sorry. So Lane County Public Health's vaccine planning process really began Long ago, back in 2009, was the last time that we had a large epidemic of a novel respiratory illness in our community. That was H1N1. From that experience, we developed plans that were specific to a novel respiratory illness in our community. How do we deal with that? How do we close down certain parts of our community to provide those space and then isolation? How do we vaccinate large numbers of people? We learned a lot of lessons back in 2009. We further honed that through our efforts with the University of Oregon and meningitis. While not necessarily a respiratory illness, it did provide a lot of lessons learned for us. So we took that to the table, and in August, the formal planning, hearing word that the approval process was going well and that we were on the verge within months of being able to have the FDA-approved vaccine on our hands, we needed to dust off those plans and adapt them to COVID. We did so quickly, and we were able to identify sites for mass vaccination. And also one of the things very key to our lessons learned in the last outbreaks and also a realization in COVID is we can absolutely not do this ourselves. This is not a job for public health. This is a job for University of Oregon, for Peace Health, for McKinsey-Willamette, for Oregon Medical Group, for our EMS population, and our entire community. And that has been true throughout the pandemic, that everybody has played a role, and we all need to be working in concert together, rowing in the same direction, if you will. So that realization really made it necessary for us to make a lot of adaptations to our plans and try to premeditate what kind of situational landscape we'd be working in once the vaccine was approved. A big part of that was really dusting off, those expectations of community partners and starting to communicate about who can do what, where, when, and how. And that's really a role for the county, to be a convener of all this expertise and all these great organizations who serve our community. And so that has been ongoing. That all happened, and then we saw the Oregon Health Authority hand down their plans for the vaccination effort. And in some ways they were different from our plans, and in some ways they were the same. And so we had to make some last minute changes. As most of you probably know, the first step in the Oregon Health Authority's plan was to distribute vaccine directly towards to our hospital groups, our EMS partners, and then also a Walgreens pharmacy by virtue of a federal contract for them to be vaccinating our long-term care facility staff and the residents at our long-term care facilities. And so Lane County Public Health did not receive vaccine in that first wave, and we were under the impression that it was going to be a strict sequencing. Obviously, I think another thing that we've learned about COVID-19 and this pandemic is things change and the needs change. And so I think the Oregon Health Authority learned what the vaccine landscape looked like and what we needed, and decided to lift that sequencing, relax it a bit, and start opening up the floodgates to all of that Group 1A at once. And so then public health started to receive vaccine. We received 1,200 doses, and then we received 100 doses, as you're aware, probably. And then we received 4,600 doses this week, with an additional 2,800 that are earmarked for Group 2. So what the role that Lane County has been serving in that process is really a gap analysis and gap fulfillment. So we're looking at where do we have ample resources within our provider community or hospital groups, EMS, et cetera, to do vaccines, and where are we deficient? And really where we were deficient is in Groups 2 and 3, those congregate care workers, individuals who work with people who experience intellectual and developmental disabilities, and then some of those medical functions. And that's where the county has stepped in and done 2 mass vaccination clinics this last week. We've equipped a couple partners in our community to help out with that effort. And then also we just received word that the National Guard will be aiding us Saturday and Sunday of this weekend, as well as Monday and Tuesday, to provide those 6,400 doses, as well as those 2,800 additional doses to those very important populations. And that's not to say that our partners left out those groups. It's just that the distribution mechanism is designed to play to strengths Obviously, EMS is a perfect partner to vaccinate our first responders, and our hospitals are great at vaccinating our outpatient settings and all the multitude of contacts they have in the provider community in Lane County. And so that's the mechanism that we have been following. And, even though our doses that have been coming into Lane County have been somewhat minimal, I think we've made good use of them. There are roughly 40,000 people in Group 1A. 40,000 people, and that if you think about what Dr. Patrick or Dr. Ludke said in regards to us being a medical hub, that we serve a big area, that really contributes to that. And we have a lot of people that are doing the good work of keeping our county and other counties healthy and safe. And so that puts us at a unique position in the vaccine distribution process. So while you might see other counties across Oregon or other areas vaccinating different populations, part of the reason that we are vaccinating the rate we are is just by virtue of the number of people that are in that Group 1A. And also the individuals included within 1A. While we have great relationships between public health and our hospitals and our provider community, some groups we don't have as established channels of communication. Individual care workers represent a unique population. Individuals who take care of folks with IDD, while we have communication with brokerages and other large groups, there are still some outliers. So there's been a lot of work to be done to establish those communication channels to make sure that we are effectively reaching those folks. And that's, a new development that is based on that OHA guidance. So with that, I will cap it for Lane County Public Health and move on to PeaceHealth's overview. So Dr. McGovern, will you please guide us through what PeaceHealth has been doing?
Sure. Thank you, Jason. So I'm going to start with a brief just recap of what we've done with COVID so far, and then move to our vaccination, and then talk a little bit about what's next for us. So it's hard to believe we've been doing this for almost a year now, but we have been. We spent a lot of time in the beginning of this developing plans to make sure that both our staff and our patients were safe, and we were able to take care of as many COVID patients as we possibly could, should surges come. Luckily, to begin this, we did not have surges, and so we had some what I call free time, some grace period to design our protocols and processes. So throughout that, we worked closely with Lane County Public Health, Mackenzie Willamette, our nursing homes and EMS partners, as well as others, to make sure that we were coordinated across the community. So since elective surgeries were able to come back, we've also been able to maintain full service care for everybody in the community. And for that, I'd like to pause and say thank you. Our ability to maintain all of our services to take care of all patients, COVID and non-COVID patients, are really a tribute to the community. All of you who have sacrificed masks, socially distanced, kept your gatherings small, sacrificed your time with family over the holidays. The result of that is that the two hospital systems in town have really been able to take care of everybody. We have not been overwhelmed. We've been a little bit busy at times, but nothing that we haven't been able to manage. And that the community gets a big thank you for. So we are very grateful for all your efforts and all your sacrifices. Moving to our vaccination, it's hard to believe we've only been vaccinating for 5 weeks. Our planning started a few weeks before that. What people probably didn't see or don't understand is that there were a lot of unknowns before vaccines even started. At the state level, the state wasn't sure how many vaccines they were going to get. That trickled down to us. We didn't know how many doses or when those doses were going to arrive. We had a pretty good sense that hospital workers were going to be the first wave, and so we started to plan for that. The logistics behind that, setting up a scheduling system, and then working through a vaccine clinic where we knew we were going to be indoors, so we knew we had to be socially distanced, to move people through line, get them registered, get them vaccinated, schedule a second vaccine, and then have them wait for that 15-minute observation period was a large amount of work for a very dedicated team for several weeks before vaccines even started. Proud of that group. We are able to move an individual through that process in under 25 minutes, and we're able to move, when vaccines allow, over 600 people through our indoor vaccine clinic. So we did start with our most at-risk employees. We started with our COVID units, our intensive care, our emergency departments, and then in concentric circles kind of moved out from that. As we moved through that group and we started to get to caregivers who were not directly involved with patient care, we did reach out to Oregon Health Authority for some guidance. Given that there are multiple systems in the background that are critical for our being able to function and continue to deliver care, our electronic medical record, so our IT department, our revenue cycle, our payroll, the decision was made to continue to vaccinate beyond direct care so that we could keep vital functionings going. So we were able to do that. We are very careful at the end of every day. I know I've had multiple questions about wasted doses. To date, this is a very precious resource, as we have not wasted one dose. We're very careful about how we tap vials and how we manage the end of our clinics to make sure that every last dose goes into an arm by the end of the day. So moving to what's next, as Jason pointed out, there's somewhere around 40,000 people in the 1A group. There is no way one individual or even, I think, a loosely organized group of entities can vaccinate all those individuals in an efficient way. So we are working closely with Wayne County Public Health, the University of Oregon, Mackenzie Willamette, and others to make sure that Peace Health is part of a unified community effort. We're working together to make sure that we are all working in the same direction with the same knowledge to ensure that we can get vaccines out as quickly as we can. We believe the sum is greater than the parts, that we can do a better job faster if we're all connected and working together than if we all stay independent. So to date, as we moved through our non-patient facing employees, we started to vaccinate those independent medical groups and other groups in 1A that are not Peace Health employed. We have at this point in time either vaccinated or have committed vaccinating 1,500 of those groups, and we continue to add as we go. Moving forward, Peace Health will make sure that we are a good partner with the community in Wayne County Public Health through either vaccinating members of the community as we have vaccine capability, or where we have surplus vaccine, we will ensure that where Wayne County has the ability to distribute those vaccines, we provide those vaccines to Wayne County. So the vaccines, they belong in arms, not freezers, and I think that's everybody on this town hall tonight. That's all of our commitment. So with that, a final thank you to our partners in the community who I've gotten to know much better through this COVID experience, but also to you in the community, both personally and from Peace Health, the grace and the patience over the last month or so. Everybody is anxious to get this vaccine. Everybody wants it. We are figuring it out, and I have been very impressed with the community's patience and grace as we've moved through this. So both myself and Peace Health, we're grateful to serve such a fantastic community. And with that, I will give it back to Jason.
Thank you, Dr. McGovern. We will now hear from Dr. Versage with Mackenzie Willamette.
Thank you. I want to echo all of Dr. McGovern's comments in terms of saying thank you to the community. And we have been very fortunate in our county to have very manageable COVID levels where the hospitals had capacity and the clinics because of all the efforts of the people in our community and all of us working together. And thank you for attending the town hall this evening. The COVID pandemic has affected all of us and all of our lives in many ways, and Mackenzie Willamette Medical Center has taken many steps to support our community and staff and patients. In the beginning of the pandemic, we saw an urgent need for more local COVID testing, and we were able to successfully partner with the University of Oregon to set up a COVID lab in our hospital and develop a drive-through testing center that we're still able to operate daily at the Mackenzie Willamette Hospital campus. To date, we have run over 71,000 COVID tests. This has been a huge support for our community because it allows earlier diagnosis. Those patients can then get care sooner. It also helps with contact tracing. And most importantly, it allows those patients to quarantine earlier to decrease the spread of the virus. We've also been working very closely with Lane County Public Health and Peace Health to make sure that we've had plans in place for surges and to make sure that we have enough hospital beds available in our community at all times to treat not only the routine medical issues, but also all of our COVID patients. We have also worked continuously and tirelessly to make sure that our staff and patients are protected from COVID while they're in our hospital. It's very important to us that all of our community feel safe going to the hospital for the medical care that they need and their local clinics. In the fall, we did have an increase in COVID inpatients in our community at both hospitals, and we were able to coordinate between the hospitals and also implement several plans we had for efficient and effective high-quality patient care. Again, those numbers never overwhelmed either hospital because of the efforts of our community. In November, when we had the official word that vaccine was coming, we moved into a lot of preparedness and planning. One of the first things we did was survey our staff and our medical staff to see how much vaccine we actually needed to vaccinate our entire hospital. That showed that we needed to do a large education campaign to make sure that everyone understood that this vaccine has been very well studied and is very safe to receive. It's been incredibly important for our medical staff to get vaccinated to not only protect themselves and the patients, but also we need our staff healthy to make sure that our hospitals can operate at full capacity to take care of our community's medical needs and in case there's a COVID surge. On December 21st, we started our vaccination campaign, and it was incredibly exciting. That was the first time in months that there was just an overwhelming sense of hope throughout the hospital, and you could feel that in the entire community. And I think that hope has led all of us to be very excited about getting our COVID vaccine as soon as we can. To date at McKenzie-Willamette, we've administered over 2,200 doses. And that includes several first and second doses. We have 3,000 more vaccination appointments already scheduled through the beginning of March, and that includes first and second doses. Early on, we did decide to keep our second doses on hand to guarantee that everyone who is vaccinated with us received both doses. We want everyone to have that 95% protection the vaccine can provide if you get 2 doses. We have a smaller space and staff, and our ability is maximized about 150 people a day. And we have been able to make sure we've had full days in our vaccine clinic every day. We also are following all of those guidelines of watching people for 15 minutes, ensuring they have a second dose scheduled, and just making sure the process maintains social distancing. And that has been a limiting factor with the social distancing and the space that we have available for us. The other thing that I would really like everyone to know is it's very important not only to our hospital, but all of the healthcare entities in the community to support community vaccination as efficiently and quickly as we can. We've been able to help support the community by providing appointments to community healthcare providers in Group 1A. When I reviewed all of our appointments, in the end, by the time we get to March, we'll actually end up vaccinating more providers in our community than in our own hospital. I also would like to say that we have not wasted a single dose of vaccine, and we agree it is a very precious resource, and we go out of our way to make sure we have exactly enough people for each vial of vaccine. To also help expedite vaccination in our community, we have transferred vaccine to Lane County Public Health. We transferred 975 doses last week, which helped them be able to run their large vaccination clinic last weekend. And we're going to be transferring an additional 975 doses this week. We hope to continue to transfer doses in any way we can to help get that vaccine in arms as quickly as possible. Mass vaccination of our community, starting with Group 1A, but then moving to everyone, is a huge effort with several challenges that you've heard about. Our biggest challenge is we have a very limited vaccine supply at this time, and there's also a lot of limits with staffing and space. We all want vaccine in arms as quickly as possible, and please be patient with us and know that we are collaborating, we are coordinating, and we are constantly moving towards vaccination. Our wish is the exact same as yours. We want you to be vaccinated. And I just looking back on the year and looking forward, it's just very important to let everyone know that at every single step, the reason why we've had such a successful response to COVID is because of the amazing collaboration and cooperation we have in this community amongst the healthcare providers, and then also the support of our community. And we're very appreciative that we live in Lane County and get to work with all of these amazing people.
Thank you, Dr. Versage. Now we will move to Chief Campy, who will fill us in about the EMS activities. Chief?
Hi, thank you, Jason. I just wanted to talk about how COVID has kind of changed it's changed the way that EMS responds to calls, and that has been a challenge in and of itself of having our patients or our callers call into the 911 center and have to be extensively questioned about any COVID symptoms, and having personnel have to don full protective equipment on every call for, we don't know who has COVID and who does not. And so eye protection, gloves, gowns, respirators, all of this stuff has happened and has changed the way that we respond to calls. We have patients come outside to be fully assessed if they're able to. We limit the number of patients, or we limit the number of personnel that go into residents to take care of patients, to help bring the patient outside in the event that they need to. It's been a real challenge, and we're really fortunate that we live in a community that has so many great supports in it, our hospital systems and all of this, but also our community of people who are doing the right thing and are trying to do the right thing. And even with that, we run into patients that need to be transported but don't want to go to the hospital. And we have patients that conversely that want to go to the hospital but may not be sick enough, or it's such a challenge right now of trying to figure out how to get the right resource to the patient every time. We're really fortunate here in Eugene Springfield that we have had the opportunity to look at vaccination for quite some time, and we were registered with the Oregon Alert System to be able to receive vaccination. And because of the size of our organization, we were fortunate because for most agencies, if they didn't have 100 people, they couldn't receive vaccination in that first go around. So with that in mind, we took our smaller agencies under our wing and made sure that vaccine was going to be available to all first response agencies in Lane County. And we counted up all of the agencies and gave that request to the state for vaccinating all first responders in Lane County. So to date, we've given 1,200 first doses of the Moderna vaccination, and mostly that's been to fire, EMS, and law enforcement first responders in Lane County. We've also vaccinated other agencies that fit into the 1A group as requested by Lane County Public Health. All in all, we interfaced with 64 different groups, which I think is pretty amazing, and we're getting ready to start our second dose vaccines next week. Eugene Springfield Fire is working closely with Lane County Public Health and others in the community to develop a strike team model of EMS providers that would be able to help vaccinate other groups that are assigned to us by Lane County Public Health. Again, I would just like to thank our community and all of our partners that are working on this project. I think that everybody is just working as fast as we can to get this distributed to our community. I agree with the others that this vaccine belongs in the arms of the people, not in freezers. Thank you.
Thank you, Chief Campy. And now we will hear from Krista Dillon from the University of Oregon. Krista?
Thank you, Jason. The university has been doing its part of responding to COVID-19 ever since the spring. We've been running a community testing program that's free and available to Lane County residents. It does have a testing capacity of up to 4,000 people per week, and that is a service we will continue to provide to the community. We're also doing our part to educate our campus community members, our students, faculty, and staff about the importance of mask wearing and physical distancing, and we will continue to do so even as vaccine becomes available within our community. We also are engaged in contact tracing and case management for our UO campus community, as well as the Greater Eugene Springfield community through our CoronaCorps program, which is actually a really cool student-based effort where our students are helping to contribute to the COVID response within our community. Understanding that the vaccination effort for Lane County is a huge lift. Unlike my colleagues on the call tonight, we are not a vaccinator. The University of Oregon does not have vaccination resources, but we wanted to offer our assistance to help, and there are ways that we've been plugging in. We are loaning staff to Lane County Public Health to help with the setup of the drive-through clinic that went into operation last week, and we'll continue to do those efforts. Our staff have lots of experience with large-scale events, and as Jason mentioned, we ran 5 mass vaccination clinics in 2015 and 16 for our meningitis outbreak. Our staff have partnerships with all of the folks on this call tonight, as well as other community partners through these large-scale events, and so this is another opportunity for us to engage in those relationships and help the broader community. In the last couple of weeks, our staff worked closely with Lane County Public Health to do the physical setup for the drive-through vaccination clinic that's in operations. And our staff also assisted with the scheduling system that's being used for those individuals to make appointments at those clinics. This is a unique collaborative effort because it's bringing together Lane County Public Health's expertise in vaccination administration with the University of Oregon's expertise in events and planning and logistics. And what's really great and what might not be seen outside is that we went from talking about this idea of a drive-through clinic and 8 days later vaccinating individuals within the county. As the vaccination efforts ramp up, University of Oregon is ready to offer additional locations, either on our campus for both drive-through and indoor clinics, as well as vaccine availability continues to grow. And our staff will continue to assist in that planning and logistics efforts, whether those additional clinics are on our campus or in other locations throughout the county. In addition, we've also offered our assistance to help coordinate the education sector for vaccination administration. That will include both the K through 12, the early learning, as well as the higher education efforts when those vaccines again become available for those groups. And the University of Oregon is committed to and looks forward to working with our partners to help again ramp up the vaccination efforts. And we thank you all for the work that you've done and the sacrifices that you've all made over the last year. And we are happy to be part of this effort.
Thank you, Krista. Finally, we will hear from Dr. Stacy Chance with the Oregon Medical Group. Stacy?
Good evening, and thank you, Jason, and thank you to Lane County Public Health for hosting this event. I think events like this are a really important part of the massive immunization effort that's in front of all of us. And I'll repeat what others have said, that this is really an amazing medical community. The partners who are on this town hall and the community in general have supported us to be able to get to this point, to finally be able to talk about vaccinating our community. So it's an exciting time. So like all the other medical organizations, Oregon Medical Group has been spending the last several weeks preparing ourselves to be able to vaccinate people in the community. Our organizations, doctors and caregivers and leaders are all recognize how essential, like others have mentioned, it is to get as many vaccines to as many people as safely as possible. It's important, I know, for everybody we're hearing from in the community. So those of you who are at high risk, for all of our patients, for families, for parents, for teachers, educators, schools, businesses, and everyone. Oregon Medical Group in particular has a great group of doctors and nurse practitioners, physician assistants, medical assistants, pharmacists, caregivers, communications team, all who are working to prepare for when we can receive and start giving vaccine to all of our patients. We're in the process right now through our relationships with partners, hospital and public health, getting our frontline caregivers vaccine. And that is helping us to continue to take care of all the patients we're seeing every day and to get ready for the time when they can then start giving vaccine to everybody else in our community. We are daily planning how and where and when we can safely and efficiently start our vaccine clinics once vaccine becomes available to us to give to everybody in the community. I think maybe the most important thing we're working on now is doing our very best to provide accurate and up-to-date information to everybody, all of our patients in the community in general. There are a lot of reasons why that's a challenge with the pandemic. Unfortunately, bad and inaccurate information sometimes travels faster than good and accurate information. And as others have mentioned, the information and plans are changing rapidly as we're responding to the disease and the availability of vaccine. And different people have different needs in how they prefer and how they can get information. So our clinics, like others, are really getting an avalanche of calls from the community. There's a thirst for to know what is going on. Everybody in the community wants to know if the vaccine's safe, should they get the vaccine, when can they get the vaccine, how will they find out how and when they can get the vaccine. So Oregon Medical Group's commitment has been and will be, and I know shared with everybody else on this town hall, is to be good stewards of the best information that we've got available. So for us, that means a lot of things. So keeping our clinicians and doctors up to date on all the information so that they can have those conversations with all the patients who are presenting in front of them. It also means us keeping up to date website, so dedicated specifically to vaccine information. And we have that at OregonMedicalGroup.com. We have a long list of regularly updated, frequently asked questions and answers that are taken directly from the calls that we're getting from the patients in the community. I and the other doctors and clinicians at OMG are sharing videos and updates and interviews there as frequently as we can, and doing that on other media sources as well, and then being available for settings like this so we can answer questions from the community. We're committed to sending out information through our electronic newsletter at least weekly and asking everybody to sign up for that so we can get you all the information we have as soon as we have it. So this is really going to be an effort, as others have said, that requires all of our organizations and the entire community. I'm really happy to be part of it and happy to have all the partners that we do have in the community. And I know Oregon Medical Group is really feels privileged to play a role in helping to end this pandemic with vaccination over the next several weeks and months. So with that, I'll send it back to you, Jason.
Thank you, Dr. Chance. And that brings us to our question and answer portion of the town hall. Before we get started on that, I'd like to echo what Dr. Chance and others have said about staying up to date on the latest vaccine information and all the websites that are available. Certainly the county has our COVID website and our newsletter, but as you've heard, Oregon Medical Group has one. I know that University of Oregon has information up, so does Peace Health, McKenzie-Willamette, across the board. We're all saying the same thing because of our collaboration and because of the communication we have between each other. So pick your flavor and please do stay up to date. Those websites and social media will be the best way for you to stay informed. Obviously, traditional media is a great source as well. They're trying to do their part and communicate that information, but staying on top of it's going to be key because unfortunately, there are quite a few variables involved in this process that Lane County or anybody in Lane County, we simply don't have the power to affect change on the amount that Pfizer produces or the speed at which they're shipped and different variables like that. So while we may be able to announce a little bit of information one day, that may change the next. And so please do stay tuned and we will share everything we have available. and also let you know when it's your turn to get vaccinated. And before we get started, I will say, as I've already mentioned, we received hundreds of questions, far too many to address individually. So we will be updating our FAQs on our website. I know that we will share the questions that we've received with our partners so they have a sense of what people are wondering in the community. And we'll also be addressing these in our newsletter that we send out weekly. So with that, I will go ahead and start that process. We'll begin with a question that I received. This question is from Ray in Florence, and I'm going to go ahead and give this one to Dr. Ludke as our Senior Public Health Officer. He gets to break the ice. So I understand why doctors and paramedics need to get vaccinated, but there are perfectly healthy people in their 20s and 30s getting vaccinated, and yet people like me who are over 70 and have multiple pre-existing conditions cannot receive the vaccine. Why wouldn't health outcomes trump the risk of exposure? Dr. Ludke?
Yes, so I think you said the gentleman's name was Ray. So thank you for the question, Ray. I guess I would say, first of all, there are certainly plenty of people who are 70 or older who have received the vaccine. They typically are in long-term care facilities, those congregate settings that are really high-risk sites. So it sounds like you're not in one of those settings. So I think lucky for you, you might be living at your own home. That's great. But there have been plenty of people who are 70 or older. They just happen to be probably pretty ill and in long-term care facilities, and they have received a vaccine or two. Secondly, again, it goes back to those ethical principles. We really need to focus on not only who's at highest risk, and again, we clearly know age is a risk factor for severe disease from COVID, but we also need to focus on those other items, such as who will keep society running, who are the persons that are really critical to the COVID-19 response. So that obviously includes people in the health space who are running our hospitals and our urgent care, and they're transporting people in ambulances, and they're taking care of people who have very brittle behavioral health conditions and maybe at risk of, say, like suicide or something that really is a really frightening condition. So we need to care for those people too. So it, again, is a combination of those ethical principles, and that combination has provided us with this rationale, this type of phased approach. Thanks for the question, Ray.
Yes, thank you. The next question comes from Brian, and Brian lives in Eugene. And this will be to Peace Health because he actually mentions Peace Health in the question. So why did Peace Health decide to vaccinate staff who do not provide medical care or have contact with the public?
So I think this is along the same theme as the last question. So thank you, Brian. As I mentioned earlier, we are a critical function in the community, not just for COVID patients. You know, people are still having heart attacks, strokes, other important emergent issues that we need to be able to take care of. The hospitals like EMS need to continue to function. So you see the nurse and the doctor and maybe one or two other people taking care of you in the hospital, but there's an entire team behind them supporting them. Our IT infrastructure is incredibly important to how we deliver healthcare this day and age. If it goes down and we don't have those individuals to get it back up again, we are severely hampered. Our employees need to be paid. Our revenue cycle needs to continue. So it was looked at and decided that, yes, they don't have patient contact, and it may not be about them at risk of getting COVID in the hospital, but they are at risk in the community, and really about keeping our critical functions going to be able to ensure that we are there to support the community and provide the services that are needed. So less about giving patients COVID or contracting COVID in the hospital setting, but more so mitigating that community risk and ensuring that they're there to continue critical functioning.
Thank you, Dr. McGovern. The next one is from Des in Springfield. And again, this one mentioned someone specific, so we will throw the question that way. Is Mackenzie Willamette vaccinated anyone in group 4? My clinic has been enrolled and refers to Mackenzie, yet I have not received the call from my staff to be vaccinated.
Thank you, Des, for asking that question. And it also echoes on what Dr. Ludke and Dr. McGovern have said. Just to give some background on the groups for everyone to know, Group 1A is clearly defined by the CDC and the Oregon Health Authority to include all healthcare providers. Originally, when Oregon Health Authority in particular came out with the vaccine plan, they divided Group 1A into 4 subgroups. Group 1 included hospitals, urgent cares, long-term care facilities, and they were prioritized to get vaccinated first, and then Group 2, and then Group 3, and then Group 4. About 2 weeks ago, the Oregon Health Authority changed its stance and recommended that the 4 groups be kind of coalesced in terms of priority for vaccination, although we still need to include the ethical principles that Dr. Ludke referred to because we have such a limited vaccine supply right now. At the same time that they changed the groupings, they also gave permission to the hospitals for the first time to be able to vaccinate community members and not just their own staffs. So at that point, Lane County Public Health and McKenzie-Willamette and Peace Health coordinated because they had vaccine in terms of starting to reach out into the community and vaccinate Group 1A. Part of those ethical principles included who should we reach out for. So initially at our hospital, we were able to reach out to an urgent care, a clinic providing care for HIV positive patients, dialysis patients, cancer patients, and primary care groups, pediatric groups, and in particular the dental community because they're very high risk. And we were able to schedule over 1,400 healthcare providers for their first and second dose in those groups. Just to give perspective, again, there are 40,000 healthcare providers in the community, and we were only able to make enough appointments for 1,400, and those appointments put us into March. Again, our max capacity is about 150 vaccines a day. In the same time that we were scheduling those clinics, we received over 300 requests from clinics needing their providers and staff to be vaccinated. And unfortunately, we just did not have the capacity to schedule everyone. And so Des, I'm sorry that we were not able to schedule you. I wish that we were. At this point in time, as all of the groups are coordinating on vaccination, the best thing for you to do is to go to the Lane County Public Health website, and they have a registration form on there. Register your clinic, and anyone in Group 1A can do that. And we are making master lists of who needs vaccine. And as appointments and vaccine become available, you will be reached out to and scheduled for an appointment. So don't lose hope. We will get there. It's just going to take some time.
Thank you, Dr. Versage. And just for full transparency, obviously, as I mentioned, we're not able to address every single question. So what we did was we had several people pour over the questions and find some representative questions that sort of hit on some common themes. So if you did ask a question, and we're not necessarily asking the exact question you answered because you've been grouped into a theme. So fortunately, there are some common themes here, and this represents one of them. And it'll be directed for Chief Campy with EMS. So how many first responders are choosing not to receive the vaccine, and what are their reasons? And this is coming from Eli in Eugene.
Thank you, Eli, for that question. We have about 83% of our personnel who have chosen to receive the vaccination. And so if we do the math on that, that leaves about 17% that have chosen not to receive the vaccination. And it's been for a variety of different reasons. Some of our staff have had COVID, and they are choosing to wait the 90 days that was recommended to be vaccinated. Some of them have had COVID and are choosing to take their chances with natural immunity. Some of them are waiting for 1 shot versus 2 shots. And as we look at other vaccinations that are being developed that will come onto the market, There are firefighters, believe it or not, that only like to get as few shots as possible. So we also have those that have chosen to just absolutely not be vaccinated. They don't get flu shots, they don't like vaccinations, and their childhood vaccinations were enough. And so we have those as well. So we have a variety of different people who work for us, and they all have different backgrounds. But I would say most of them, I'm really happy to say 83% have chosen to be vaccinated. When we look at other fire departments of like size, we're hearing the same thing from those other agencies, that about 83 to 85% of people are choosing to be vaccinated at the first responder level. Thank you.
Thank you, Chief Campy. And yeah, I think it's worth mentioning too that the same goes for the healthcare space as well. There's a variety of different levels at which people are getting vaccinated across Oregon and across the country, and the reasons are diverse. I think we've been very fortunate the levels that we've seen of uptake here in Lane County, and certainly there's a lot of demand for everybody that turns it down. There's 5 or 10 waiting in line. So definitely a great question. The next one, again, this one's earmarked. I've heard of this so-called logistical support U of O is providing. Wouldn't it be more efficient for University of Oregon to do mass vax out of their very abundant, well-equipped facilities? And this one's coming from Michael in Eugene.
All right, I can take that one. And so I mentioned earlier that we are in a supporting role for vaccination. And so the University of Oregon is not a group that can pull off mass vaccination on our own. And in fact, some of the facilities you may be referencing are currently being used for COVID testing. And so when we quickly in those 8 days went from having a conversation about a clinic to actually having a clinic, that played into the decision-making in terms of where that clinic ended up. We are working through plans on how to co-locate the COVID testing and COVID vaccination opportunities. And as vaccine becomes more available, we will stand up additional drive-through and indoor clinics, some of it which may end up being on our campus. And as I mentioned, we're ready and willing to help with that. But given the speed in which we needed to set up that first clinic, some of our facilities just weren't ready to do that at the time.
Thank you, Krista. The next one is an open-ended question, but Dr. Chance, you haven't had a turn, so I think we're going to pick on you. I had COVID for about 2 weeks in September. Should people like me get the vaccination, or should we rely on some level of immunity? This one comes from Steve in Elmira.
Thank you, Steve. That's a really great question, and I think it's a good example of that we're constantly learning the answers to these questions around COVID and vaccine. So it certainly appears as though having COVID does give you some level of protection for a period of time, but we don't know exactly how long and how good that protection is. As Chief Campy mentioned, some people are electing to wait at least 90 days because it does appear you get some protection during that time after having COVID. However, as vaccine becomes more available, it does look like it will be our recommendation that everybody get the vaccine, including people who have had COVID. So certainly if any questions come up when it is available to you, you can talk to your doctor. But the short answer is that yes, you can and should still get the vaccine.
Thank you, Dr. Chance. The next one I'm going to throw to Dr. Lutke. This one has a little policy nuance to it, so maybe you can attack this one. This one comes from Jenna in Cottage Grove. Which group will independent senior living be in? They may not be in a long-term care facility, but it is certainly a congregate care facility. And they do flu clinics at these facilities. Why can't they do a COVID clinic? Dr. Lutke?
Yes, thanks for the question, Jenna. So if I understood the question correctly, I believe they will fall into group 2. These are the other types of congregate settings. And by congregate, we mean sort of what that word means. It's a group of people under one roof, so to speak. That includes assisted living facilities, independent living. It can also include jails and prisons. people who are living together in a congregate setting, but they may not be the long-term care facilities and skilled nursing facilities that were in the first priority group. So they will be in group 2 of phase 1A. And we vaccinated a fair number of them over the weekend in our 2 mass vaccination clinics, and our colleagues here on the town hall today have vaccinated a fair number as well. If Jenna is having trouble getting plugged in, she's to speak with the staff of her facility and find out who they are working with to get vaccine into that facility, because they could be vaccinated now.
Thank you, Dr. Leckie. I have one here that may not have an answer, and since Dr. McGovern is a smart individual and it's his turn again, I think we'll direct this towards Peace Health. Herd immunity seems somewhat unrealistic at the moment, and at what level of vaccination within the community would you say the hospitals would be safe from being overrun? This one comes from Stephanie in Springfield.
Stephanie, that's an excellent question that I don't have the answer to. Herd immunity is somewhere between 80 and 90%. So this is probably a little different than herd immunity. I do believe that as we ramp up with vaccine, as more vaccines come online, as we really build the infrastructure of vaccinations to be able to accommodate more and more individuals, we're going to see our ability, the number of people getting vaccinated rise very quickly at some point in time. I think somewhere around there, as we're really vaccinating thousands of people in Wayne County a day, then our risk of being overwhelmed goes down. I don't have a specific answer to that, and to show how well we're collaborating, I'll ask Pat if there's anything in the public health literature that speaks to that. I've seen herd immunity, but not necessarily sort of the protection of the healthcare community's capacity to care for individuals.
I'm happy to add a little bit, but I don't think I have much more to add. I think the question really was a good question, very specific to just the hospital capacity, as opposed to how do we prevent those large wildfire outbreaks in our entire community? And we would like to see at least 70%, but it could be 80, 85, 90. We're not exactly sure. But in terms of the hospital, I would just say that, again, I think echoing what the others had said earlier, our hospitals could have been overwhelmed, but because of what each of you did out there in the community, you prevented our hospitals from being overwhelmed, as we saw in Seattle and New York City and Northern Italy. The hospitals weren't overwhelmed. They were stressed a bit for a time. ICUs and some of the wards were full, but it was prevented from being overwhelmed. So we're learning more, and as we get more data, we will share that. I took notes on that question. Thank you for that question.
Jason, if I can just add, I don't know if you have anything coming about continuing to mask, but we haven't talked about it much. I believe we are going to continue to be wearing masks for the foreseeable future as this ramps up and we understand more about the vaccines, their efficacy on multiple levels. So unfortunately, we will all be masked for a while.
That's a great point, Dr. McGovern, and thank you for adding that. And also to our panelists, if you do have a great point like that you want to bring up, please do feel free to interrupt me. Harm in that. The next one I will give to Dr. Versage. This one comes from Elaine and Eugene. And when we were looking at the questions, we actually received this one quite a few times. So Elaine, you're not alone in this question. And for all of you who asked this, I think it's a great consideration that we should talk about. Is there any benefit to taking an antihistamine before being vaccinated to avoid an allergic reaction?
That is a fantastic question, Elaine from Eugene. And just some background, any medication that you take, including vaccines, can cause an allergic reaction. And allergic reactions have a pretty wide range. It could be something like a rash called hives, or something very significant and severe, like an anaphylactic reaction. Both of the COVID vaccines in general have been shown to be very safe and have very limited allergic reactions. What we've seen since the vaccine has been started to be given on a wider scale with the Pfizer vaccine is about 1 in 100,000 people will have an anaphylactic reaction. And in general, the patients that had that had previously experienced anaphylactic reactions with vaccines or with other medications. So anyone who has seasonal allergies, allergies to food, pollen, grass, because we live in the Willamette Valley, or antibiotics should not worry. Those types of allergies are more common and do not necessarily increase your risk of an anaphylactic reaction. And also one other thing to know is that if you have had an anaphylactic reaction to a COVID vaccine or an mRNA vaccine, it is contraindicated to get the COVID vaccine again. Medicines that are antihistamines like Benadryl are helpful because they do decrease that allergic reaction by calming the immune response. There are no national guidelines or national recommendations to take an antihistamine like Benadryl before the vaccine, but there are a couple of expert opinions out there suggesting it. My suggestion to you would be to talk to your primary care provider about it. They can review your allergy history and the pros and cons of taking an antihistamine and help you make that decision. Again, I just want to reiterate that the COVID vaccine has great safety data. What we've seen in our experiences is people receiving the vaccine mostly are having a sore arm or some redness at the site, and those are actually positive things. Those are signs that your immune system is building protection for you, and it means that you will be protected from COVID. And so again, very safe to get the vaccine, and if you have questions, you should definitely talk with your healthcare provider.
Thank you, Dr. Visage. This one is earmarked for EMS, so Chief Campy, coming your way. Who makes up the group of first responders? Is it just EMS? This one comes from Crystal in Eugene.
Thank you, Crystal. So who makes up the group of first responders? For us here locally, it is our 5 ambulance service area organizations. Eugene Springfield Fire makes up 2 of those: South Lane Fire Rescue, Lane Fire Authority, Western Lane Fire and EMS Authority, and Oak Ridge. So we all have staff at those organizations that run the ambulance service, as well as first response in our communities. We also have first responders in our community that volunteer as firefighters that are also EMS providers, all the way to ski patrol people who are up on the mountain waiting to respond to people in the event that they get into trouble. We are all serving in our rural communities as well as in our urban areas. Law enforcement, Eugene and Springfield Police Departments, Oregon State Police, other police departments in smaller communities such as Cottage Grove and Florence and others, they all make up that first responder. Who is that first responder? We also look at our behavioral health first responders like Cahoots in our community. I don't know what we would do without them. We're really fortunate that they're here, and we want to make sure that they are protected. Also, when we look at our, our federal partners, our local FBI, U.S. Marshals, ATF personnel, all of them make up that category of first responders. And so when we're thinking about it, it's broader than we think in the first stroke. It seems like it should be not very many people, but when you start to look at it, it actually is a large safety net of people that surround us that act in that first responder role. Thank you for the question.
Thank you, Chief Campy. We have another one here that's specific to University of Oregon. Krista, up for one more here. How will University of Oregon prioritize vaccine for students, employees, particularly those who work in a frontline position and do in-person service?
Yep, so the University of Oregon is working on our vaccine plan, and we will make vaccine available to our faculty, staff, and students when we're permitted to do so within those state and federal guidelines and priorities. And our intent is to vaccinate our staff who are working on campus first, and then move to our faculty and staff who may be working remotely.
Thank you so much for that. I have another one that is specific to Oregon Medical Group. Dr. Chance, you have a patient here. I am a senior and a patient of Oregon Medical Group. I do not want to go to some big event where I might get the flu or worse. Will my doctor be able to give me the shot in the future? This one comes from Bonnie and Eugene.
Well, thank you, Bonnie. It's another great question. I'm really glad to hear you are making plans for getting the vaccine. And I know we can't wait until a time when we can offer it. The safety part is really important for us. So in our planning, we're thinking about how to best use our space and time to run vaccine clinics in a way where everybody can get it safely. So we had a good experience with our flu clinics this year during the time of COVID, getting creative with how we gave vaccine clinics, and including doing our first drive-through vaccine clinic at OMG. We plan to make use of our after hours, weekends, and if possible, another drive-through clinic when we get COVID vaccine. So I would definitely keep your ears open, sign up for the newsletter. We will make available all the ways in which vaccine will be made available through those venues for you. So thanks again for the question, Bonnie.
Thank you, Dr. Chance. So we are also receiving questions live via our Facebook Live stream. Folks are commenting on there. A lot of the questions really have to do with prioritization, and a lot of the questions I can just tell you right now, we don't have the answers to. But there are a few I think that we can at least address and maybe share the answer to the question. So I will begin with Dr. McGovern on this one. This one has to do with these new strains of COVID that we've seen happen in Europe and in the United States. This one's from Marianne and Eugene. Are you worried about the potential of a virus mutation in COVID, and especially one that might be vaccine resistant? Explain how that works.
Sure. So viruses are mutating all the time. If you look at influenza, it's a virus that mutates and requires a vaccine every year that's sort of customized to the variant that comes through. So we don't know yet whether coronavirus is going to mutate in that way, and we're going to have to change the vaccine, and it's going to be an annual event. There's one major protein, the M protein, that the antibodies and vaccines target. To date, I don't believe that we've seen a variant that has escaped the vaccine, so to speak. In talking to a couple of our infectious disease physicians, they use serum or blood from somebody who's had COVID, and they test those natural antibodies against these new variants. And to date, those individuals' blood who have had COVID are able to neutralize the variants that have been identified. So as of yet, we don't believe that any of these mutations have escaped the vaccine. However, that's always a concern, that if we have a major variant that escapes the vaccine, that throws a major wrench into things. So we haven't seen it yet, but obviously that's a concern. So thank you for the question.
Yes, thank you. The next one, same thing goes in. Oh, first I'll pause. Is there anybody else on the panel that would like to add to what Dr. McGovern just said? All right, hearing nothing, I will move on. This one comes from Monica. I don't know where Monica's from, but she says, she asked rather, I have asthma and I'm not sure how serious this underlying condition is in terms of COVID. Could you put my condition into context in terms of being an underlying condition and how that might affect when I receive the vaccine? So I do know that we have not received guidance about folks with underlying conditions necessarily in some cases, but across the board from OHA, we haven't. So what I think I'll focus on in your question, Monica, is really that piece around contextualizing asthma as an underlying condition. Dr. Versage, would that be something you could address?
I'll do my best, and I'll frame it that I'm a OB-GYN. So Dr. Chance might be good at weighing in on this. From mostly my understanding of what I've seen come through the hospital, it really age is the largest risk factor to be most concerned about a severe outcome from COVID. And that's why those initial vaccination groups focus largely on age. And then also looking at underlying illnesses like diabetes and hypertension. In general, asthma is a respiratory condition. And so patients who have that and then have a respiratory infection definitely can have an exacerbation of their asthma symptoms. But I'm not aware of any data that would lead to a worsening outcome.
Well, since you punted to me too, I will add, I agree. I think CDC lists asthma as a condition that might raise your risk, but it's not as clear of a risk as other conditions that Dr. Passage mentioned. Certainly age, diabetes, suppressed immune system, those are the real big players in terms of high risk.
Thank you both for weighing in on that. Are there any other comments or attempts to address that question? All righty, then I'll move on. I have one I think that is perfect for Dr. Ludtke. So Dr. Ludtke, this person, this one is anonymous. They ask, why haven't pharmacists and pharmacy technicians been prioritized for vaccination? We are certainly at risk and seeing sick individuals on a daily basis. Doctor?
Well, gosh, a fair number of them have been vaccinated as part of the healthcare worker space. And it sounds as though I'm wondering if this person who asked the question is a pharmacist, or perhaps their partner or family member is. They should be getting vaccinated through their place of work. And if they're not, they should log on to our website, Lane County Public Health, and find out where they can get vaccinated. Because again, they are serving as healthcare workers, and unless they're retired or they're not serving in that space anymore, they should be prioritized into getting their vaccines.
Thank you, Dr. Ludtke, and I'll add on to that your pharmacy should be aware of the enrollment process and how to receive the vaccine. And I would encourage you to have communication with your leadership about that process. We've been communicating with most of those entities and can help if need be. So if you do run into any problems or complications, feel free to follow up with additional email. This next one is from Fran. Fran says, or asks rather, is there a list of people willing to be on call for short notice to make sure vaccines are not being wasted? And so, Fran, I'll take this one. We do have a list of organizations that the county is vaccinating, that if we do have an abundance of vaccine or more than we can use once we've opened the vial, that are on call and ready to be vaccinated, because we are implementing some form of prioritization with our space. So we're able to give those folks a call and get that vaccine distributed ASAP. Of course, that's just in 1A. And I do know that the same sort of relationships and lists are happening at the other points of distribution, that they have folks that they can contact in a moment's notice to get that vaccine in arms. And as people have mentioned, it belongs in arms and not in freezers. That's the mantra we've all been saying. And as folks have articulated, no doses have gone to waste because of that demand. Now, I think what you're getting at maybe though is that general population. And so certainly there will be a mechanism by which we will be able to get a hold of folks should there be excess doses at an event that we can then get through. So with that, we are now running out of time. We only have a few minutes left. I would like to open it up to our panel. If there are any closing remarks that they would like to make to the community, any reminders, anything for the good of the order, let's go ahead and hear from you now, and then we'll wrap it up.
I'm happy to start. I'm going to end with a downer, and somebody else can make it an upper. So the first is that we really have to recognize how remarkable it is that we have any vaccine at all. I would really ask everyone listening or watching today to not lose sight of that fact. To have a vaccine, once again, as I said, that is effective and approved in the same calendar year that a new agent shows up in our country is really phenomenal. That being said, we are not in the place we want to be as a community with the number of infections we're having right now. We are getting 1,000 confirmed COVID cases every 13 days in Lane County, and we have been averaging 1,000 every 13 days since November 11th. It has been a long time. This is the peak of cases. It is in a place that we really don't want to be, and we need to continue to be safe and healthy for several more months until we move into more immunity from infections and vaccine and the weather gets better. So please keep that in mind. Who wants to take the upper side of this? Go ahead.
I'll go there, Pat. I do agree we can't get complacent now. We have to continue to do the things that have kept us healthy as a community. I do think silver lining out of all this is you see the faces on the screen and the community pulling together. I've never experienced this in my career. It's been 18 months that are a little over since I've been here, and I've just been really impressed by the medical community, by the community at large. And I just can't say enough how grateful I am to be part of the Eugene Springfield community, Wayne County community, and all the great things that have been accomplished and will be accomplished in the next 6 weeks as we really build that vaccine infrastructure that hasn't existed before. I just, to everybody, my counterparts on the screen, thank you, and I appreciate all of you so much.
I'll jump on there too, and I think while it seems daunting, it's about problem solving. There are hundreds of little problems and big problems that we'll need to solve, but I think it's important that everyone know that we have really good, solid problem solvers in this county. And as Dr. McGovern mentioned, it's through these relationships and partnerships that we're going to just tackle those problems one by one and work our way through this together. And again, we are very excited to be part of that effort and just want to continue to help us move this forward.
I'll add quick. Go ahead, Jess.
I just want to echo the teamwork and collaboration has been phenomenal, and that will lead us to be successful. So please, continue to be patient, ask good questions. We appreciate the community's support as we move forward together in vaccinating our community. And I also just want to echo with knowing that Oregon did have one positive case in Multnomah County, I think I said that correctly, of the new variant of COVID. We know it's been a year of COVID and everyone is exhausted, but please hang in there with us right now with this more infectious strain in our backyard. It's extra important, like Dr. Ludke said, for us to all hang in there, continue to mask, continue to social distance, continue to wash your hands, and continue to protect our community until we can get everyone vaccinated that we need to.
Yeah, I was going to add similar thoughts. I think it's a really hopeful and exciting time, which is great. It also means we can't get complacent with everything that we know we need to do over the next several months to keep infections down. And as Dr. McGovern said earlier, it's going to require a lot of ongoing patience and grace for all the people who are trying to get the vaccine to you and can't as quickly as we would like to.
All right, anyone else? Very good. Thank you so much for joining us tonight. Just your willingness to tune in, to sit here for an hour and a half and talk about vaccines, I think is a public health dream come true. So we're talking about silver linings, and that's certainly one of them. It's out of necessity though, and we hear you, and we hear the urgency in our community. I hear it in the phone calls we get, the emails we get, the social media comments that we see, and each and every one of those is felt and acknowledged. we're going to do everything we can to keep you in the loop. We're going to do everything we can to move as quickly as we can through the phases and vaccinate you as soon as humanly possible. There's a lot of questions we didn't get to tonight. I apologize for that. Time has its limits, but we're going to also make sure that we address those in some way, either in our press conferences, newsletters, websites, what have you. Again, thank you so much for joining us. And here's to a great vaccine effort.